Hey everyone, welcome back to the channel, Health Hub. And today we're diving into a topic that's close to my heart, your health. Specifically, we're going to be looking at 5 health concerns that are on the rise globally. From surprising statistics to prevention strategies, let's dive in. Welcome to my channel. Today we're discussing 5 rising health concerns that deserve our attention. Let's kick things off with an issue that's often hidden in plain sight: mental health. The World Health Organization reports a massive spike in depression and anxiety since 2019, a 20% increase. We've been through a lot these past few years: a global pandemic, social and political unrest, economic uncertainty. Even before the pandemic, loneliness was already a major public health concern. We live in a world that's increasingly digital, leading to more social isolation. 1 in 4 adults experience mental illness each year, and 40% of Americans report feeling lonely. This isn't just about feeling down. We're talking about serious conditions like depression, anxiety disorders, and even suicidal thoughts. So, what can we do about it? The first step is to break the silence. Normalize talking about mental health, just like physical health. If you're struggling, reach out to someone you trust. A friend, family member, therapist. Remember, you're not alone in this, and if you're not struggling, be that person for someone else. Check in on your friends, family, colleagues. A simple "how are you doing" really can go a long way. Beyond talking, there are other things you can do to protect your mental health. Exercise is a big one. Even a little bit of movement can boost your mood and help clear your head. Mindfulness is another powerful tool. Meditation, yoga, or just focusing on your breath can help manage stress. Don't underestimate the power of hobbies. Engaging in activities you enjoy can do wonders for your mental well-being. Pick up that paintbrush, dust off that guitar, or join that book club. Your mental health will thank you for it. Remember, small steps can make a big difference. Let's support each other and prioritize mental health. Together, we can make a change. Let's move on to a threat that's a little less visible but no less concerning: antibiotic resistance. Antibiotics have been hailed as miracle drugs, saving countless lives by treating bacterial infections. But overuse and misuse of antibiotics have led to a surge in drug-resistant bacteria. We're talking about a 30% increase in resistant bacteria, threatening the effectiveness of modern medicine. The statistics are sobering. 700,000 deaths annually worldwide are attributed to resistant infections. Experts project that number could skyrocket to 10 million deaths by 2050 if we don't get this under control. Part of the problem is overprescribing. Sometimes antibiotics are prescribed for illnesses they can't treat, like viral infections. Patients not completing their prescribed course of antibiotics can allow bacteria to survive and develop resistance. The way we use antibiotics in agriculture, particularly in livestock farming, is also a major contributor. So what can we do? Use antibiotics responsibly. Only take them when truly necessary and follow your doctor's instructions. Don't demand antibiotics if your doctor doesn't think you need them. Finish the entire course even if you start feeling better. Good hygiene practices are crucial. Wash your hands frequently, cover your mouth and nose when you cough or sneeze, and get vaccinated. Support antibiotic stewardship programs that promote the appropriate use of antibiotics. These programs are essential for slowing the spread of resistance. Together, we can combat antibiotic resistance. Chapter 3. Our changing climate, our changing health, climate change-related health issues. Climate change is having very real impacts on our health right now. Rising temperatures, extreme weather events, and air pollution are directly affecting our well-being. One of the most immediate impacts of climate change is the increase in heat stress. More heat waves can be deadly, especially for the elderly, young children, and people with underlying health conditions. Even gradual increases in temperature can lead to heat exhaustion, heat stroke, and exacerbate respiratory problems. Climate change is a major driver of air pollution, linked to respiratory illnesses, heart disease, stroke, and some types of cancer. The World Health Organization estimates that air pollution contributes to millions of premature deaths each year. Climate change is also affecting the spread of infectious diseases. Disease-carrying insects like mosquitoes and ticks are expanding their ranges, bringing diseases like Lyme disease, Zika virus, and dengue fever to new areas. The statistics are alarming. 150,000 deaths annually are attributed to climate change. We've seen a 25% increase in heat-related illnesses since 2000. So what can we do? Address climate change at its root by reducing our carbon footprint, transition to cleaner sources of energy, reduce reliance on fossil fuels, and adopt more sustainable practices. Support policies and initiatives aimed at combating climate change. Stay informed about the health impacts of climate change to better protect ourselves and our communities. Together, we can make a difference. Chapter 4. The weight of the world, obesity and related diseases. Obesity is a complex issue with multiple contributing factors, from genetics and lifestyle to environmental and socio-economic factors. Regardless of the cause, the consequences are clear. Obesity significantly increases the risk of serious health problems. We're talking about conditions like type 2 diabetes, heart disease, stroke, certain types of cancer, sleep apnea, osteoarthritis, and even mental health issues like depression and anxiety. Obesity puts a tremendous strain on the body, affecting everything from our cardiovascular system to our joints and mental well-being. The numbers are staggering. 39% of adults worldwide are classified as obese, and 1 in 5 deaths is attributed to obesity-related diseases. These numbers have been steadily rising for decades. So what's driving this epidemic? Highly processed, calorie-dense foods are readily available and often cheaper than healthier options. We're leading increasingly sedentary lifestyles, spending more time sitting in front of screens and less time engaging in physical activity. Our environment plays a role too. Communities designed around cars rather than walking or biking, and limited access to healthy, affordable food options. So what can we do? Adopt healthy habits. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Incorporate regular exercise into your routine, aiming for at least 30 minutes of moderate intensity exercise most days of the week. Be mindful of portion sizes and make conscious choices about the foods you eat. Create environments that support healthy choices. Make healthy food options more accessible and affordable, promote physical activity in our communities, and support policies that encourage healthier lifestyles. Together, we can combat obesity. Chapter 5. The Silent Thief: Sleep Deprivation and Disorders. Sleep deprivation and sleep disorders have far-reaching consequences. In our always-on, fast-paced world, sleep is often sacrificed. But sleep is not a luxury, it's a necessity. Just like eating a healthy diet and getting regular exercise, getting enough sleep is essential for our physical and mental health. When we don't get enough sleep, our bodies and minds don't function optimally. We're talking about a whole range of negative consequences, from increased risk of chronic diseases like heart disease, stroke, type 2 diabetes, and obesity, to impaired cognitive function, mood swings, weakened immunity, and even an increased risk of accidents. The statistics are concerning 1 in 3 adults doesn't get enough sleep, and we've seen a 30% increase in sleep disorders since 2010. Sleep deprivation is a serious public health concern, costing the US economy an estimated $411 billion annually. So, what's keeping us up at night? Stress, anxiety, depression, medical conditions, medications, and our modern lifestyle. We're surrounded by screens that emit blue light, which can interfere with our sleep-wake cycle. We're working longer hours, commuting further distances, and juggling more responsibilities, leaving less time for sleep. So, what can we do? Prioritize sleep. Make sleep a non-negotiable part of your routine. Create a relaxing bedtime routine, limit screen time before bed, and create a sleep-conducive environment that's cool, dark, and quiet. If you're struggling with sleep, talk to your doctor. There are effective treatments for sleep disorders, and addressing any underlying medical or mental health conditions can also improve sleep quality. Outro: your health, your hands. So there you have it, 5 alarming health issues on the rise that deserve our attention. We've covered a lot of ground today, from the silent epidemic of mental health to the invisible threat of antibiotic resistance, the far-reaching impacts of climate change, the growing burden of obesity, and the often overlooked importance of sleep. These are complex issues with no easy solutions, but the good news is that there's a lot we can do to protect ourselves and our loved ones. By staying informed, making healthy choices, and advocating for change, we can make a difference. Remember, your health is your most valuable asset. Share this video to spread awareness.